This is indeed African Diaries, and time for us to get into a conversation concerning the healthcare of our mouths. Now, we are going to be speaking to Dr. Tshidi Mahlogo, who has over 20 years' experience as a dentist. She's previously worked at Wombat's Hospital for the South African government before becoming self-employed in 2015. She's also an entrepreneur and the founder of a business breakfast market that we will be finding out toward the end of the conversation. For now, let's talk all things dentistry. New trends, new things that we're following, potentially from TikTok that we probably shouldn't be looking at, but we are still doing it, like the banana peels and the coconut oil and the bicarb and the mixture of all of those with lemon juice. Listen, if you have hopped onto that bandwagon and you're saying, Shayla, I don't know, my gum feels weird, or my teeth are sensitive, or listen, everything is working perfectly. This is not to take you away from your current practice. This is to give you counsel, to give you wisdom. And she joins us on the line. Dr. Tshidi, thank you so much and welcome to African Diaries.
Evening. Thank you so much for having me.
Doctor, so here's the thing. If we are to be honest, there's quite a bit that's going on when it comes to healthcare of the mouth, right? I want us to start with understanding how this then plays its role in the entire body, because we just learned now that part of the mouth is connected to the brain, part of the mouth is connected to the gut, and all of these intertwined. If I'm not taking care of my mouth, surely this will affect other parts of my body. Perhaps give us just an overview of how the mouth is connected to different parts of the body and how, if not taken care of, we'll see results in other places.
Okay, thank you so much. Of course, even though as dentists we work in the mouth, we're taught that we are working on a body of a person, because your body, it's connected by the bones, it's connected by your blood vessels, it's connected by your nerves, and everything runs a unit. Just for example, when you eat your food, there's a message that is sent first to the brains. There's what we call nerve receptors. The message will be received that, okay, you got your food. Like your food first go to your stomach, but later on, they say it actually takes 10 minutes for your brain to record that, okay, you are full or you have food in your stomach. So it's just an example to show you that our bodies are connected. But however, should you have a decay that extends into your root, inside your root is where we find your blood vessels and your nerves. Number one, a message records you're gonna feel pain. It will seem like your life stops. But if it's an abscess also, and then it is left longer, that pus can extend through your blood, because our blood moves all over our bodies. It can eventually be dangerous and can even make you to land at a hospital if you get I forgot this other
Abscess.
condition where you have an abscess which is bilateral below your mandible.
Yeah.
So in so many ways, and
Sure. Dr. Tsidi, I think what scares me is, unlike my arm, my physical, I suppose what I can see to great extents and I can deal with, the mouth has nooks and crannies that we never get to see. You know, I don't think I will ever have the opportunity to see the hind of my last set of teeth. That's a dentist will have the opportunity to see that. And so it begs the question what looking after my teeth means, looking after my mouth as a whole. I think of the tongue. I think of how they tell us to floss, and then when you floss you bleed, and then you change toothpaste, and then you realize that hurts you, and now you want to use salt because that's what people are saying, and then you fall into the trap of social media. So let's talk about how to take care of these beautiful sets of teeth. Where do we start? Is it a morning brush? Do we brush after every meal? Do we floss after every meal? How should we take care of our teeth?
Yeah, definitely not after every meal. That 2 minutes of laving your teeth,
Yeah.
I mean, the advert that you're playing, that's what we should stick to, even though there could be trends, basic remains. We still, just like we need to bath our body, so we should continue taking care of your teeth by brushing them twice a day for 2 minutes. That is in the morning. You can brush before or after your breakfast, but in the evening, it got to be after your last meal of the day, because in the evening while we are sleeping, that's when the bacteria get an opportunity to can cause decay on your teeth. And then we got to floss our teeth before we brush our teeth, just to, yeah, release that plug in between your teeth, because most people actually their teeth get decay in between because they do not floss. It's not easy, yeah, to floss, because it takes your time. But most of the time, I advise my patient to do it while they are seated, even on the couch. Just yeah, floss, 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 and then later on, then you get to brush your teeth. And then after every meal, uh, we recommend that you at least drink water. If you can check in the olden days, that's what they used to do. Instead of juice or any soft drink, they used to just pass on their food with water, and the water will flush off that plaque. And it's even the best healthy drink that we need for our bodies. So yeah, that's what can help you to reduce your plaque. Anything but to reduce your plaque. And snack on an apple instead of on any junk food like your knickknacks, biscuits. Their fruits are recommended as they are your healthy sugar.
Sure, Dr. Tshidi, I'm thinking about, so we're flossing and we're brushing our teeth twice a day, and then I'm thinking about other things I've heard. And this is just me letting my thoughts run wild. I heard somewhere that one should chew gum as opposed to use mouthwash, because mouthwash apparently started off as a detergent. Started off as a detergent to clean surfaces. The formulas apparently haven't changed much. And this is what we're putting in our mouths that's then affecting our dental structures, and we're not even cognizant of it. How true is that statement? And should we be using mouthwash?
That statement is not true. As I was talking about how to take care of your teeth, I even forgot to mention that you also need to come to us at least twice a year for cleaning. You either go to your oral hygienist or dental therapist or dentist, because most people they just know dentist, to have your teeth clean. When we are done, we still even give you the mouth rinse to rinse off your mouth. It's not true, it's not a detergent, and we still prescribe it if you have removed your teeth, or you're having any infection, or you have just had a minor oral surgery in your mouth, you have sutured, then we still recommend the mouth rinse, 0.2% chlorhexidine mouthwash, or your Andalaxy. Yeah.
Dr. Tsidi, what of the reality that people say that mouthwash dehydrates your mouth? When it dehydrates your mouth, of course, affecting the pH in your mouth, thus leading to other issues within the frame of your mouth. Is that true as well? How do we battle against that if that's the case?
Uh, if it does dehydrate your mouth, then you need to drink water. But I'm not aware of any mouth. I think I would have heard it from patients. Because
Yeah.
also, if you happen to have an accident and we have to do the bimaxillary fixation, where we stabilize your bones. So the mouth rinse is the only thing that you can use, at least to clean the inside of your oral cavity,
Yeah.
because you can only brush on the outside, as your teeth will be like this. Yeah.
So, Dr. Tsidi, perhaps let's bring some rest to minds. Let's find out from you, is mouthwash alcohol based, or are they some that are alcohol based and then others that are not?
Mouthwash, it's alcohol based.
That is
It's
fair, but
af-
you're saying that it's not destructive, right? It's not the kind that would dehydrate your mouth, completely bring an imbalance of the pH in your mouth, therefore causing other issues.
Yes, I was even about to say, just like many other syrups, they are usually alcohol based. But whatever is used in the mouth, they always make sure that it is not harmful to the body. Otherwise, it wouldn't be used in the mouth, just like many other materials that we use to fill up your teeth and do all sorts of treatments.
It is 23 minutes after 11 p.m. Central African time. Dr. Tshidi Mahlogo joining us on the line. We're talking all things dental and oral health. If you do have questions, find us on WhatsApp +27 6340 69126. Dr. Tshidi, again, I think these questions are for me personally. I'm going to ask about the tongue. Yeah?
Tongue.
Because yeah, how do you clean that thing with all its sensations? And I'm saying this because I have seen that some people have been affected by the toothpaste that they use, and then they develop these ring worm-like looking things on their tongue. If that's not the case, then they'll either have tongues that are very white, right? And there's almost like a little mucus buildup on the tongue that sort of then overshadows the entire mouth, and you find yourself needing to clear your throat. And these are some of the issues that arise because your tongue is not clean, or you're not cleaning it correctly, or you may be over cleaning it, causing more mucus buildup on the tongue. Perhaps walk us through that.
Uh, yes, you can get ulcers. We call them the aphthous ulcer, which can be caused by stress. Some of them, just like the ulcer in your tummy when it's caused by stress. Even in the mouth, you can get some of the ulcers that are caused by stress. But however, some are caused by the high bacteria. So in your mouth, or like you are mentioning, not cleaning your tongue. um but some of the conditions in your mouth could be signaling the medical conditions that you could be having. For example, when we see candida, the whitish layer that you're talking about is the oral candida. If we see that, mostly we talk to the patient and find out when was the last time you consulted with your medical doctor, because it could be, yeah, signaling the medical condition like your HIV, or even diabetes, maybe which hasn't been diagnosed, because like whatever conditions that causes immunosuppression. But we know that the number one leading is your HIV, so we can actually pick it up in the mouth, but without, yeah, mentioning so much. We just encourage consultation and making tests. But yeah, we can also be specific. At the end of the day, it's still a consultation. And diabetes, we could be seeing a loss of, severe loss of bones, as a loss of bone, because your gums will go down. So it could just be signaling that there is immunosuppression in your mouth, and also delay in healing. So even when you have diabetes, it's important that you mention to us that you do have, so that we can prescribe the antibiotics for you, because you don't heal, yeah, quickly like other people. But when it is controlled, uh, it's also better. But we always just prescribe those antibiotics for those that are having diabetes, to be safe, so you can heal.
Dr. Tshidi, I know that you have touched on this. You kind of did give us a link between the stomach to an extent, and the esophagus and the mouth, but I want you to unpack the relationship between gut health and mouth health. And the reason why I'm saying this is a lot of conversations are spiking up concerning gut health, right? And we're finding that the gut health is linked to your brain, it's linked to your eyes, it's linked to every part of your body. Let's talk about the link between the mouth and the gut.
The gut. Everything that is in our mouth, we eventually swallow. And in actual fact, the oral cavity has the highest rate in infection, or should I say, but in we call it oral flora, or in bacteria. A lot of bacteria are actually found in the mouth, and that is why we need to clean our mouth, because when we don't clean, whatever is in the mouth, it will eventually go down our gut, because when we eat, everything goes down. So the bacteria that are not cleaned, they can eventually lead to the conditions that are affecting the gut, your gut. And there's also a lot of cancer that is going on, but that is also related with the things that we are eating.
Dr.
So
Tshidi.
cleaning your mouth is very crucial to reduce bacteria in your mouth.
Sure. I mean, we're understanding that, but more and more this conversation is becoming scary. Dr. Tshidi, I'm going to ask, I don't know what device you are speaking into or the mic that you are using. We are experiencing some kind of feedback from your end. Perhaps just avoid it being on a reflective surface. If there is a surface that is directly reflecting the speaker's sound, then it will bounce back to us. So just if you can, just avoid that on that end. In actual fact, let me do this. Let's send you back to producer. And when we get back, we'll continue this conversation. A quick and short breather.